Good evening, everybody. Thank you so much for inviting me to talk about this, and thank Mr. Savage for that great lead-in story, because really his story is one I unfortunately hear almost every day of my clinical practice. And his story is one that unfortunately is later into the disease than we would like to see people, because by the time you have fractured bones and danger to your spine and kidney failure, things that can happen from this disease, the horse is way out of the barn. So the goal is to try to know about this disease well enough to think about it when it's earlier in your body, where screening tests can find it at a time where it can be treated before you have pain, before you have debility and renal kidney troubles or bad infections that you've had because of this. So, multiple myeloma is the name of the disease. You might be curious why it's called that. 150 years ago, the only thing we knew about this disease was that it caused multiple holes in the bone. Mile, bone, oma, hole, multiple. Lots of holes in the bone. It wasn't for more than 100 years later that we figured out that this had something to do with abnormal proteins in the blood, and then figured out subsequent to that, and that's only fairly recently, within the last, say, 70 years, that these things called plasma cells were really the cause of the problem. So could somebody help me advance the slides? I'm sorry, I don't think I have control up here. Is this working? Yes. Oh, it does, okay. Down. Ah, good, thank you. Right, so just a quick legal point. I have no relationships to pharmaceutical industries or anything that's going to affect anything I say in this talk. So I thought I'd start with the most basic comments and build up from there so that everybody's on the same page with what we talk about. What is blood? So blood is a vital substance pumped around our body to every part of our body, and everybody needs a constant supply of nutrients and a constant immune surveillance. This is the sort of thing that the blood supplies. Carries oxygen from our lungs. Oh, can't hear me. Carries oxygen from the blood, carries nutrients from the GI tract, carries things that you produce in other cells like the liver around the body. That's the normal situation that you want to have every day, and every part of the body needs that. Blood is composed of fluid and cells, and it's the cells we're here to talk about today, because blood cancers are cancers of cells that start in the bone marrow and then get into the blood. The fluid is filled with a whole bunch of important things, chemicals, proteins, all sorts of things that we eat, breathe, and produce in other cells, and the cells travel around the body with repair, immunity, gas transport, and other functions. So that's what your blood does under normal circumstances. So what are these blood cells that course around in your veins and arteries? Most of them are these things called red blood cells. The red blood cells are there to carry oxygen and other gases, actually, like CO2. And when these cells are low in your blood, it's called anemia. And that's an important thing for you to remember, because one of the first signs of this disease, multiple myeloma, is anemia. If you have anemia as an older person, you should ask your doctor, why do I have anemia? And multiple myeloma may be a cause of that. And if you catch it at that point, before you have a whole bunch of other problems, you're going to be way ahead of the game. So remember anemia. Now, another cell in the blood is white blood cells, and they're there to fight infections, and when these cells are low, bad infections can occur. One of the type of white blood cells that doesn't actually get into the blood but stays in the bone marrow is this thing called a plasma cell. These are a kind of white blood cell whose function normally is to make antibodies, proteins that bind to things and make them targetable by the immune system, like bacteria that get into your blood or other bad things that might happen to you. Finally, there are things called platelets that help you from stopping to bleed. When these are low, we can bruise and bleed. Now, these cells generally don't get low in multiple myeloma unless it's very severe. But again, the red blood cells can get low even early in the disease. So that's why it's so important to remember, if you have anemia, you got to get an answer why you have anemia from your doctor. There we go. So what is bone marrow? Bone marrow is this stuff inside the bones, mostly in the central part of our body, where all the blood-forming cells live. So they're in our bones, these cells, as they're made into the cells that finally get into our bloodstream. And the plasma cells are one of those cell types that's made in the bone marrow and mostly stays in the bone marrow. Cancers of blood cells often start with abnormal cells in the bone marrow and sometimes get into the blood over the time that they grow more and more. how do we know what's in the bone marrow? If you have anemia or if you have other abnormalities of your blood, sometimes the doctor is going to want to look inside that bone marrow and figure out what might be going on. And that's what we call a bone marrow biopsy. You typically lie on your side or face down in the clinic. The doctor goes in with a little needle. He takes a core sample, like a core sample from the earth, and that has bone and the bone marrow in it. And we can look at that under the slide, and it looks like this, the cells all together. And we can also take the fluid from between the bones and smear it out on a slide, and that's what that looks like. These are what normal bone marrows look like. We'll talk about in a minute what happens in multiple myeloma. Now, what is cancer? Because multiple myeloma is a kind of cancer. Cancers occur because all cells in our body, from the ones on the tip of our nose to the ones in our colon and our prostate and everywhere around our body, have to go where they are and stay there and only grow a certain amount and not give you 2 noses and 3 toes more than you need. So that control is under control by a set of instructions in every cell of your body called DNA. But if something goes wrong in that instruction set in just the right way in certain cells, they can start to grow beyond that which they should. And that can result in the cells growing faster. Oops. Oh, what did I do there? Oh, sorry, I pressed it too long. So for certain kinds of cells, for certain kind of cells, that's going to result in a tumor, a collection of cells. So if you have, for example, you know you're supposed to get colonoscopies when you start at age 50. You're supposed to get those because early colon cancers will grow as a little tumor. If the doctor can find it early enough, he can snag it out of there and it doesn't become a worse cancer. Those early tumors can save your life when they're caught early. However, there's other kinds of cells, when they start growing faster, they don't keep together in a tumor, they spread out. And myeloma is one of them, plasma cells. They'll spread out all through your bone marrow. And as they do, they'll cause other problems that we'll talk about. So other types spread around, right. So this is what, again, a normal bone marrow looks like. Lots of different cells. Cells that make the platelets, cells that make various kinds of white blood cells. Plasma cells are normally here, normal ones in very low numbers. And even cells that have very dense circular nuclei that eventually become red blood cells. So that's what a normal, healthy bone marrow should look like. What happens when a single plasma cell takes on genetic abnormalities and starts to just make multiple copies of itself long over time? You get this, a bone marrow that's filled with these big cells that stain blue because they're filled with protein, antibodies that they're making, except they're only making one type of antibody because this is a copy of the same cell over and over again. It doesn't have anything to tell it to stop growing. So it starts to fill up your bone marrow in all those places that you saw, in your spine, in your pelvis, in your arms, in your legs. And that growth of those cells leads to several different problems. One problem is that as the myeloma cells crowd out all the other normal cells, it leads to that anemia we talked about before, low red blood cells. So again, if you have anemia, you need to know why. So find out from your doctor why you have anemia. Also, as it grows, it crowds out the other normal white blood cells, and you get infections more easily. So if you're getting frequent infections, frequent urinary tract infections, frequent pneumonias, things that you shouldn't be getting all that often, you ask your doctor why and study that a little bit more. Now, another thing that happens is because you notice that all these cells are very blue. They're blue because they're filled with those antibodies, and they're filled with a whole bunch of the same antibodies. And when you get a bone marrow full of this, the protein level in your blood gets very high. High enough that when you pee, it looks like the foam on a head of a beer. If you're peeing and you're not seeing just a few bubbles, but you're seeing foam that's staying there, that means you got protein in your urine. That's not a good thing. You need to know why. Now, if you're a diabetic, you may have albumin spilling out into your blood. That can certainly fit into your urine, rather. But if you're a patient with lots of these plasma cells, all that foam may be because of all that antibody that it's producing. And if that keeps building up, it'll gum up the works in your kidney just like a bad filter in your house and your air conditioner, and that will cause your kidney to fail. So if you have kidney troubles and you don't know why, you need to find out why, because sometimes it's related to elevated protein levels. So if you're an African American with anemia and kidney troubles, you better talk to your doctor about whether you have elevated protein levels and might be having a plasma cell problem like multiple myeloma. Now, the last thing that he has mentioned already in great detail was all the back pain that he had when he presented with his disease. And Mr. Savage had the problem where the plasma cells make a signal that turn on bone-eating cells in your bones. You might be surprised to learn you have those kind of cells, but we've got cells that are making bone and eating bone all the time. Our skeletons are constantly turning over. But the myeloma cells make a signal that turn on those bone-eating cells to be super active. And what happens over time with that? Your skeleton gets weak, and eventually you fracture your bones. And those fractures can happen in your arms or your legs, they can happen in your spine, they can happen anywhere. Back pain is a very common problem, but it's a common problem only later after the plasma cells have left the barn. Again, if you can catch this when you have anemia or a high protein level in anemia, before you get all those other problems of infections, fractures, and other things, you can be treated more easily and not get into the difficult problems that some people face when they have more disease with this. So that is, I'm going to stop here because that's the introduction to what you think about in the diagnosis of myeloma and the things that I want you to be thinking about if you have any of those problems. And later in the talk, we're going to talk a little bit about what we do about all that. So I'm going to turn the podium back over.